How's everybody doing? Another chapter coming along to you. And this is going to be chapter number 11, the bankruptcy chapter, right? Chapter 11. Oh boy, there's a political joke in there somewhere, but I'm going to just steer clear of it. So anyway, we're going to be going on and continuing on with exercise science and the assessment and the equipment around this assessment. So assessment is basically just assessing. You're assessing the person, you're assessing the situation. And we have certain types of equipment, certain different types of equipment that we're using in different circumstances to measure certain parameters and certain data that we're trying to get. Heart rate, blood pressure, could be blood profiles, could be VO2, could even be simply height and weight. So a scale, some sort of like stadiometer to be able to measure height for that. So you'll get to know some of the terminology around some of these, something like a stadiometer. You maybe never heard of a stadiometer, but you know what a height scale is, and that's essentially what that is. You maybe never heard of an ergometer. Maybe have mentioned it earlier in the semester, but before this year, you may not have heard of what an ergometer is, but you've probably used one, which is a bike or a treadmill. That's what an ergometer is, as long as it's able to measure some sort of work output. That's basically what it's doing. So meter is to measure, and ergo is work. So measuring work. So one of those SAT type of questions. So we're just going to go over some of the basic equipment that is being used within exercise science. This isn't the end all be all of all the equipment that we can use, but it is some of the equipment. And I just want to go over some of the basics, some of the things to maybe look forward to moving forward. And so we'll certainly have some experience with some of this here with the next couple years, and you'll be exposed to it. And hopefully we get more equipment in and you can play around with it during class, maybe outside of class. Maybe you want to do a study. Or maybe we just go into the lab sometimes and just goof around. Not goof around in a dangerous way, but goof around in terms of experiment a little bit. But first, let's do the lecture. Okay, chapter number 11, the last one that we will go over. And this is equipment and assessment in exercise science. So some basic concepts about the assessment that we can do and the equipment that we can use within exercise science. This isn't the end all be all, but again, it is the basics. So what is assessment in exercise science? Assessment and evaluation of physical, physiological, and psychological attributes that provide insight into a number of different parameters within our lives. So health status, overall health status, could be anywhere from blood pressure, heart rate, could be blood profiles, such as cholesterol, could be triglycerides, maybe glucose. Then also the risk for certain diseases and illnesses. And we talked about epidemiology and the epidemiological studies and why they are important. And that is part of this. And the responses that we have to training, and then also the rehabilitation programs. Then also the potential for success in sport and athletic competition, which a lot of people are obviously very interested in, because exercise science a lot of times deals with athletics. In fact, most of you, or a good portion of you, will probably go into maybe athletic training or some sort of athletic type of field, maybe personal training, or it could be strength conditioning, could even be coaching as well. Now, there are some pre-testing guidelines and procedures that we do need to follow, at least most of the time. We need to be able to make sure to control for as many variables as possible. Some of the individual issues to control for. So anything that could affect the subjects, the patients, the clients, so that the accurate results are the ones that are obtained. Something that isn't festered with some other type of variable, such as the weather. And which leads into the next point, the field tests versus the laboratory tests. Which type is more appropriate? In most instances, the laboratory tests are more controlled. You can control for environment. You can control for intensity. You can control some maybe psychological factors as well. You control the lighting. But for field tests, that's a little bit difficult at times. And the reason for that is because there is the atmosphere. The sun could be shining one day, and then the next day it's super cloudy. One day it could be 80 degrees out. The very next day it could be 50 degrees. And that's going to make a huge difference on the impact of the data that's actually coming from whatever test that you're trying to perform, especially if it's an aerobic exercise. But in the laboratory, you can usually can control for most of that type of stuff. Now, we can't control everything. There's obviously going to be variables that are going to be very tough to control. We can try to tell people eat a certain diet, drink a certain amount of fluids, but whether they actually ingest that or not, we can tell the patients or the clients to sustain from drinking any alcohol or maybe certain medications. But, people may drink that type of stuff or take those pills regardless of what we actually tell them. But most of the time in laboratory settings, we can control a lot of that stuff. When we go out into the field, sometimes we can't necessarily control that, especially if it's kind of like a random trial, or if maybe more of an observational type of trial. It can be a little bit difficult to actually control some of those variables. But we want to try to control as many as possible, any of the what we would usually refer to as extraneous variables. So outside of the scope of the main variables that we're looking at, and try to control them so we actually get real numbers or true and accurate numbers of what we're trying to measure, so we can come up with good conclusions then. So our first set of devices that we can actually use within exercise science. In fact, you've probably used them before. You may or may not have actually called them this name, but they are ergometers. A treadmill is an ergometer. A stationary bike is an ergometer. An elliptical is an ergometer. So these allow for control of the actual measurement of the intensity in the amount of exercise that is performed. We can actually take these devices and measure the work output from them. Sometimes it's digital. Sometimes you actually have to go through and do the measurements. Sometimes it can be a little bit more difficult if you don't know how much of pressure is on a bike, or maybe the treadmill speed is unattainable. You're just at a certain speed and it has no readout, maybe some of the old school style treadmills. But most of the time with newer treadmills, newer bikes, newer ellipticals, we are able to determine what the work output is, usually in wattage. Could even be just mile per hour, could be the percent of the grade of the treadmill. So one of these then would be the bike. And we have one just like this here in the picture. So figure 11.1, this is a Monarch style bike. Monarch, I believe the company is from Sweden, and we have one just like this. There is a pendulum on the side, which actually determines how much weight is placed upon a strap that actually comes up into the front of the bike and then around what we refer to as the flywheel, which then puts resistance on the flywheel. And as you're pedaling, you can feel this resistance. So from that, we can measure how much wattage or how much output that you're actually putting forth, because it takes a certain amount of energy to get that moving. And all we need to do is just be able to measure the resistance and measure the speed at which you're going, usually in revolutions per minute or RPMs. And from that, we can determine a lot of things. We can not just determine work output, but we can estimate VO2, which is the volume of oxygen that you're consuming. We can do a VO2 max test on this. It might be an estimation. It's not actually more of an indirect way in terms of measuring the gases coming out, but it can be a fairly accurate way of measuring aerobic capacity. We can do a number of different trials and testing procedures. We can do experiments on bikes like this, and they're very vital for exercise science because we can measure the actual work output, and it's fairly easy to. In fact, some of these bikes can do heart rate. And in fact, the Monarch bike actually has a sensor to where it can pick up on a polar heart rate monitor. I have seen them actually pick up the Apple Watches before. Some of the treadmills will also pick those up. Maybe not 100% reliable in terms of the actual connectivity of it, but it will pick it up every once in a while. And it seems to be fairly accurate as well. The smartwatches have come a long way which is another piece of equipment that somebody could use. It's more of a personalized piece of equipment. Usually labs aren't going to have a lot of smartwatches laying around. A lot of, grab an Apple Watch or an iWatch and there you go, get on the bike. Usually people have those with them. Could be Fitbits though, something like that. But mostly the heart rate monitors are going to be the straps that you actually put around your chest. Those are the ones that are usually used in research. Not just a stationary leg ergometer or a stationary bike, but you could have an arm ergometer as well. Again, Monarch makes these also. So they'll have handles on them and you basically just stand there and you're pedaling with your hands. So it's a different style of exercise. And these are important sometimes if someone can't use their legs. Well, obviously, if they can use their arms, then you can actually determine some work output from that as well. But it also adds a little bit different of a parameter in terms of looking at maybe heart health, because this does actually put a little bit more stress on the heart when you're using your arms, especially for high intensity exercise. Sometimes you can actually see these combined where you have a leg and an arm ergometer at the same exact time. And those look like fun. I've never used one, but those certainly look like fun. This one in particular that's shown in the picture has a weight stack on it. This one is the same principle. You put some amount of weights on it and there is a strap that is going around the flywheel, puts resistance on it. And from there, you can determine from the RPMs plus the resistance, you can determine wattage. Something like this can also be used for anaerobic exercise capacity in your work output there. That is a Wingate test, WINGATE. And that one is a high intensity exercise, usually lasting 30 seconds. That's the most common trial for that. We might possibly do that when we visit the lab. I don't know. Or maybe if we've already visited it, depending upon what semester it is, because I'm recording this in the past at some point. Looking at cardiovascular and pulmonary function assessment. There are many different ways we can measure this. We can do it just simply by a stopwatch. We can just have a step test. We can have a walk test. But there are other more advanced pieces of equipment. And these are the metabolic measurement equipment measures that we can get. The volume of air that's inhaled and exhaled. So the total volume of air in and out. The amount of oxygen that we are actually consuming. So when we say consuming, we're actually bringing into our bodies. We're breathing it in, inhaling it, goes into the lungs, goes to the heart. The heart then pumps it to the body. And then on the way back, it goes to the tissues. And then on the way back to the heart, into the lungs, we breathe it out. Breathe out, I guess, some of what is left. And pretty much looking at the differences between there. And seeing how much we're actually using downstream, and downstream meaning at the cellular level, usually within the muscles is what we're talking about here. Then also the amount of carbon dioxide that we're producing. When we go through aerobic metabolism, we're producing H2O, water, and carbon dioxide. So we're going to be breathing out carbon dioxide, obviously, that you may have heard that before at some point. So we're going to be producing some CO2 and we're going to be breathing it out, and we can measure that. As long as we have CO2 and we have oxygen that's consumed, and we have those two measurements, we can determine a lot of things. We can determine how fit somebody is from an aerobic standpoint. We can determine how many calories they're burning, calorie rate. So how many calories they're burning per minute of a certain intensity of exercise. We can also determine how many fats they're using or how much fat they're using in relationship to the total caloric expenditure. And we can do the same thing with carbohydrates as well. We can determine approximately how many carbohydrates they're using and utilizing for that exercise. One of the most common devices for this, this looks like maybe a little bit of an older version. That computer looks a little bit older, but this is a Parvo Metabolics cart. We have one just like it in the lab. And there's a couple of different pieces of equipment down here that are going to be able to analyze the gases. Those gases then are analyzed in terms of the carbon dioxide and the oxygen. Nitrogen is also kind of in there as well. But from that, it feeds the information to the computer and it pumps out the information, and we can actually see how much oxygen we're utilizing, how much carbon dioxide we're producing. It'll give you a lot of different numbers, total amount of air in and out of the lungs. And from there, we can go through the many different array of data and maybe see about total caloric expenditure. We can see carbs versus fats. We can maybe estimate a little bit of lactate threshold being something that is a pretty important part of how well someone can perform in the long distance exercise. So the entire time we're producing lactate, the higher intensity we are, the more lactate we're going to start producing because we're going to start using more and more of the anaerobic system to help with that intensity. And you'll see a gradual increase in lactate. And then there's a certain point, though, that the body cannot clear it out quick enough, and it just starts to shoot up pretty substantially. At that point, that's the fatigue point, essentially. You're going to hit the wall, and you're going to have to drop down in intensity or just stop the exercise and rest and recuperate from that. We can estimate that at least through this, but we can also do it directly if we actually take lactate measures, which is a finger stick. So we can even use needles in exercise science. We can use finger sticks. So the Lancet, so we can look at blood glucose. We can look at lactate that way. We can also do blood draws. That's a fairly common way of looking at some of the data. Now, the Parvo cart, and there are a few like it, they're not 100% mobile. And you can move them around. You can move them to different buildings if you want to, but you can't necessarily wear them on your back. You can't wheel them around a track or anything like that and run beside somebody. So one of the problems is that if we want to do something outside, usually we have to estimate their VO2, and we can do that in a number of different ways. But if we actually had a device that was light enough to where it didn't affect them and their running economy, their ability to run properly, and their biomechanics, didn't constrain them enough in terms of their breathing, we can get a more accurate measure of what's actually happening out in the field. And there are devices that that can use that. And some of them have gotten smaller and smaller and much better and more efficient. That's probably something that we're probably going to see, at least from my view, in my opinion, I would hope at some point within the future, the next 10, 15, maybe even 20 years, we're going to see these devices become very small, basically small enough to where you could wear them on your back, possibly on your hip. You're still going to have to breathe in and out of some sort of either mask or mouthpiece, but it's probably going to Bluetooth your phone, or even if you just had a TRS signal going to your phone, a little cable going to your phone or something. I'm sure there's going to be something that'll become nice and small and nice and very, very compact. I'm not talking about what is seen in the picture here, but I'm talking about basically like the size of your wallet or something like that, or size of an iPhone. Something that isn't going to impede the actual running process or exercise process. I think that's probably the future. Maybe. I hope so. Will it be just as good as some of the stuff that is in the laboratory? The Parvo Metabolics cart. There are a couple other ones. There's a Moxis, I think is the company's name. And are they going to be the same? Is it going to be very accurate compared to those which have been used for numerous research studies? I would hope so. So the question might be then, if you have something very, very small like that, what's the point of having the big piece of equipment when this can just be, I mean, you could do it in a classroom if you wanted to. You don't have to wheel this big piece of equipment around. But anyway, my mind kind of wanders a little bit. I'm just starting to think about the future, man. I'm just starting to think about the future. All right. Some other ways that we can measure cardiovascular and pulmonary functioning: electrocardiographs, or EKGs, basically, or ECGs. So they record the electrical impulses of the heart. We also have something known as a pulse oximeter, sometimes referred to as a pulse ox, and this measures the oxygenation within the blood. You've probably seen or heard some of these in the past year or so. This is 2021, if you're watching this in the very, very far future. And we have just went through a weird time. And one of the things that people were using the pulse ox for, not just in the medical setting, because people were struck with COVID and they were on a ventilator. You need a pulse ox to basically be able to tell how much oxygen they're actually getting in their blood. And the pulse ox is very good at that. And you can wear them on your finger. They're very simple devices. You can buy them off Amazon right now for, oh man, less than $10, I think is what I've paid for a couple of them, for the lab. So what we've actually used these for, there have been a lot of people that have questioned, can somebody actually breathe with a mask on? And what is their oxygen levels after so long a period of time with a mask? And so they've actually tested this with a pulse ox. That's actually how they examine this. So you may have seen it or heard about oxygenation of the blood, SaO2 or arterial saturation, or SpO2 possibly. And that's basically how they're measuring it with a pulse oximeter. Then also anything dealing with blood pressure. You've probably seen a blood pressure cuff. You probably had somebody take blood pressure on you before. So usually there's two different devices there with a blood pressure measurement, and that is going to be the actual cuff itself and the dial. It could be digital. Most of the time it's going to be analog, where it's like a clock, and that is going to be known as a sphygmomanometer. And you're also going to have a stethoscope usually with that. So this is an example of a pulse oximeter. You can see here this little clip goes on your finger and then cord going into the machine itself. It can give heart rate, and it can also give the arterial saturation or oxygenation of the blood. Some other things that we can use, musculoskeletal function assessment. So you can have pressure sensors within equipment itself. So within the insoles of shoes, and this is going to be looking at the forces that somebody is applying to their feet as they're walking or running or landing or jumping. And then another thing that we can have is a very specialized piece of equipment known as an isokinetic dynamometer. So what is this? What does it actually mean? So dynamometer, you're looking at either pressures or forces, torques, sometimes. And isokinetic is the same. So the iso meaning the same. And then kinetic, you're looking at basically the speed. So you're trying to have the same speed or a similar speed throughout a range of motion of a joint. And you're looking at the forces then, or controlling for the forces possibly in certain scenarios. So you're just measuring force during some sort of isometric or isokinetic movements of the muscle. And the isometric movement is if, say, you put your hands together and you press together, that's isometric. The muscles are contracted, but there's no shortening or lengthening of those muscles. So this would be an example of one. This would be a Cybex machine. This was actually something that I used in a research study previously, and this one is of the knee. You can actually rotate this machine around. You can do all the joints of the body, pretty much. You can do ankle, you can do knee, you can do the hip, you can do elbow, you can do the shoulder. I think you can even do the neck as well. Sometimes what this is used for is for rehabilitation purposes. You can do pre and post testing, seeing how strong somebody is getting within a certain joint. Maybe someone's going through an ACL injury, and you're just looking at what the data is showing in terms of how are they progressing through the rehabilitation program. You could also use this in research study like I did, and I was basically looking at fatigue rate. What I did was I hooked it up just like it's shown in the picture here, in that they were doing contractions of the leg. So this was leg extensions, and I was looking at 50 maximal contractions as quickly as they could possibly do them, 50 of them. That's it. It was intense. I did it numerous times myself. It was kind of fun to do. It's actually known as a Thorsonsen's test. And I was looking at caffeine and rate of fatigue, and I didn't really see much, to be honest with you. Saw a little bit of difference in females, whether it was significant or not. I'm not 100% sure, but again, you can use it for all different types of joints and muscle groups. You can also do things like EMG or electromyography. You can look at the twitching, basically, or the stimulation of the muscles during this type of activation, and seeing if there's any type of delay between the signal getting there and the actual contraction of the muscle. So there's all kinds of different things you can do with something like this. But again, it's a specialized piece of equipment. Most labs aren't going to have them. I would like to get one at some point, but I don't know if it's something that we absolutely need. A lot of times you're going to find these in bigger labs that are kind of multidisciplinary. So some other ways that we can measure musculoskeletal functioning: magnetic resonance imaging, or otherwise known as MRI. We can also do something like muscle biopsies. Oh, this is fun. This is what I refer to as the core sample of the muscle tissue. So there's usually a local anesthetic that's applied or applied. Well, I guess there could be one that's kind of applied and then some sort of numbing cream, and then injecting some sort of local numbing anesthesia, and then being able to inject a needle, a pretty thick gauge needle, and take out a sample of the muscle itself. And you can see in this picture, it's actually taking a sample of one of the quads. It's actually the vastus lateralis. So the one kind of on the outside of the leg. That's actually one of the more common places for them to take it. And in a lot of research that was looking at maybe different muscle types, possibly muscle growth, differences in the amount of or the concentration of carbohydrates or glucose that was within the muscles. A lot of them are going to be using this method and these types of equipment to be able to measure all of that. And you almost need that type of stuff. So if you want to actually measure how many muscle fibers somebody might be gaining, well, you need the actual muscle itself, because you need to look at it under a microscope. Some other methods, a computed tomography, so mapping of the body. One of the more common ones, however, it's expensive and it's a little bit more of a specialized piece of equipment. Again, is known as a dual X-ray or dual energy X-ray absorptiometry, or otherwise known as a DEXA. So this uses X-rays to measure bone. In fact, it was originally developed, I believe, to measure bone density. In fact, most of the bone density research that we have on like osteoporosis and osteopenia is measured using this particular device. But the benefit of it is that it just doesn't take bone density. We can actually get fat, and we can get fat-free mass, which is the muscle mass. So we can determine body composition pretty accurately from this device. It is, in terms of accuracy, it's probably just as accurate as what we refer to as the gold standard, which is underwater weighing or hydrostatic weighing. And we have one of these in the lab. The hydrostatic weighing device we have in the lab. And again, that's known as the gold standard. We'll go over that once we get to physiology of exercise. We'll probably even do it in exercise testing and prescription. And maybe even if you're an athlete, you may be taking part in that as well. We're probably going to be doing on numerous athletes. Wrestlers probably going to be a group of them. But I believe the swimmers are interested in that as well. So this is a picture of a DEXA. So normally the technician is not going to be standing right beside them because this is X-rays. So it's probably not going to be a good thing. They're going to be trained to how to use this. And it is pretty simple to be a patient in. I don't want to say a patient, to be a subject in, if you ever get one of these done. I've had one of them done way back in grad school. You can see that it's open. This isn't like an MRI. If you ever got an MRI, you're kind of like all claustrophobic in this tube. This is pretty simple. This scanner will basically go over top of you, and it'll go on the side, on either side, and then it'll go underneath you, and it'll scan the body from 4 different sides, and it'll give you a breakdown of bone density, fat mass, percentage of fat, and then also muscle mass, or the percentage of fat-free mass. And it'll break it down between your head, your torso, your arms, your legs, your pelvis. It breaks it down into these different pieces so you can look at it. One of the funny things is when I first seen it, I didn't realize how fat your head is. Just to be honest with you, I mean, I'm not necessarily the I guess the least fat person in the world, but a lot of my good number of my friends actually were. They were in 6-pack condition, I guess. Had a couple of them, and even their heads were like 35% fat. And I'm like, okay, I don't feel so bad now, because mine was right around there too. But if you think about it, the brain is just the electrical system, right? So there is actually a lot of fat in the electrical system. We have myelin tissue, or myelin sheaths, that are within the nervous tissue, and these serve a purpose. These are made up of Schwann cells, or fatty tissue. So the brain is essentially a lot of fat in there, and that's why the head was kind of fat. So there we go. I don't know why I'm kind of ranting again. Let's move on. Measuring body composition continued. We can use something like densitometry. There's a lot of different methods to this. DEXA is one of them. But we're basically just measuring the body density. The underwater weighing is one of them. Basically, you're getting in water, and we need to dunk you into water, and we're going to see how much you float. So if you go underneath the water and you sink, the more you sink and the heavier you are, the denser you are, meaning that you have more fat-free mass versus fat mass. And through some different calculations, we can determine your body density, and from there we can determine percentage of body fat. So, again, that's known as the gold standard. Dual energy X-ray absorptiometry, the DEXA, is also just as accurate, but it's more expensive. We also have bioelectrical impedance, or bioelectrical impedance analysis. Excuse me. This is an electrical current that is flowing through the body. It's a very low voltage. You don't even feel it at all. Even if you maybe had some metal in you, maybe you had plates or screws from an injury, that doesn't matter. Usually you want to take jewelry off if you possibly can, because it can possibly affect the results. But this is what you see sometimes at a gym, where you have the handheld one, hold out in front of you. It looks like it has little metal spots on it where you need to grab it. Sometimes it's the feet, so it almost looks like a scale. Sometimes there's actually sensors on the hand and the feet. So the principle behind this is that it's low voltage, and the impedance actually comes from fat. So the slower the current is flowing through the body, the more fat somebody has, because it's actually going to be flowing really nicely through muscle tissue, because muscle tissue is full of water, but also electrolytes, which helps it flow much quicker. But it's going to slow down through fat, because fat doesn't have a lot of that. It mostly just has fat. Other ways of measuring body composition: skin folds. So the little calipers, and there are many different types of these calipers. Some of the very cheap ones can be accurate enough depending upon the person. But these are essentially measuring the subcutaneous fat underneath the skin. You need to make sure to measure the fat, not the muscle, and the skin. There's a lot of different sites to actually measure. The most common is a 3-site skin fold, and it's actually a little bit different for males versus females. To go a step further, maybe something a little bit more accurate, is a 7-site skin fold. I think there's other ones that are 10, 11, 12, I think up to 13 or 14 skin fold sites. Some of the common ones are the tricep, the subscapularis, so in the back of the shoulder blade, The mid-axillary, which is kind of right there in the middle of the ribs. That's kind of the tickle one. You kind of pinch that one. It's kind of a little bit of a tickle. There's one right at the top of the hip or the iliac crest. There's the abdomen and the thigh, and also the chest as well. And there's just different sites you can measure. And then once you plug those into an equation, you can estimate body density. And then from there, you can get body fat composition and percentage. So these are also known as anthropometric measurements. And these aren't the only anthropometric measurements. You can take waist hip circumference. So measuring the actual waist, which is actually 1 inch above the belly button versus the widest part at the hips. You can actually just do waist circumference. That's also one of them. You can take maybe other measurements of the body as well, but those are kind of the common ones, the waist hip ratio or just waist circumference. And skin fold measurements are also another way of the anthropometric measurements as well. So, and another one that you may or may not have seen before, maybe you've seen pictures of it, but this one is known as a bod pod. It is a similar principle in hydrostatic weighing or underwater weighing, in that underwater weighing is determining the displacement of water. The bod pod is determining the displacement of air. That's really the major difference. This one is pretty accurate as well. A lot of labs have gotten this one because it's a little bit easier to do. It can be a little more comfortable for some people. The only downside to this, or the biggest downside to it, is that if somebody is claustrophobic, it gets a little tight in there. However, with underwater weighing, somebody has to be underneath the water. It's usually a floating device and the water usually isn't that deep. So there's safety mechanisms in place where people shouldn't drown. So there should be a very, 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 very low risk for that. But it can be a little uncomfortable at first, because for the hydrostatic weighing, when you go underneath the water, you want to get rid of as much air in your lungs as possible, or that's going to cause some error. Not error, error, ERROR. And what you need to do is breathe out forcefully as much air as you possibly can. You're still going to have a little bit of air left. That's the residual volume, but we need to calculate for that later on. But we need to make sure to get as much air out as possible. And that can be uncomfortable because normally when you go underneath water, you normally take a deep breath in instead of a deep breath out. That's can be a little scary at first. So, anyway, that's just some of the differences there. But for the bod pod, you basically just kind of sit there. So it can be maybe a little bit more comfortable for some individuals. So this one was a BIA machine, or biological impedance analysis. So you can see the contact points on the feet, the metal portions here. This will also do weight as well. Most of them will do weight, but it'll do body composition. So it'll give you percentage of fat. A lot of times it'll give you possibly body density, but also fat-free mass along with that. And the last portion here with devices for rehabilitation and the equipment that is associated with that. So we have some resistance devices. We can use regular barbells and dumbbells, but also elastic bands, medicine balls, any type of stability devices, the regular medicine balls, the ones you can stand on to look at your stability, any type of parachutes or weighted vests. So it's just not the normal resistance type of training devices that we think of. We can also use some of those other ones like the elastic bands and medicine balls. The kettlebells have gotten really big in the past decade or so. So those can be incorporated into this as well. And one other thing I wanted to mention too is a picture here of a guy that's walking, obviously. And you can see that there are little white spots on him in different locations. And those are sensors. Those sensors are actually going to be put into a computer and it's going to analyze his gait. And you can wear a whole suit like this. You can put these little sensors on different places. You can actually have some of these as they're actual devices that are on straps, and they will signal information to a computer, or they might have way to download the information that they're getting, and those can actually get velocity of the joint. So angular velocity, they can get speed, they can get direction. And these are used for biomechanical purposes, efficiency of movement. They can look at maybe determining if someone has an irregular gait, or if they're maybe landing properly or improperly. So a lot of different things for performance, but also for rehabilitation as well, and maybe even diagnosing some issues that are going on. This is also used in Hollywood and also in creating a lot of video games. They've used this quite a bit. This is the motion capture that they use quite often. They just put little reference points somewhere on the face or the body, anywhere, so they can have some reference points. And they put it in the computer, and they usually have like some sort of skeletonized version of it. And then they're actually able to put different layers on top of it. Usually in exercise science, we don't normally have all the different layers on top of it. Once we put it in, usually it's either just a skeleton or maybe a musculature movement, or almost like a stick figure. We usually don't need to go so far as we have some creature up on the screen or anything like that. But this is used quite a bit. And these are kind of fun to play around with. We were able to play around with one when I was in grad school. But again, a little bit more specialized. If we want to look at getting some research done with something like this, I don't think it's out of our realm of possibilities to actually get it. So, all right, that was chapter number 11, Equipment and Assessment in Exercise Science. So that was the intro to equipment and exercise science. There's a lot that we could have covered. We can have something as simple as a stopwatch, or a heart rate monitor, or something as complicated as a DEXA, or maybe a Parvo metabolics cart, or whatever metabolic cart someone might be using, and anything in between. And just because somebody doesn't have the equipment doesn't mean they can't do research or do some sort of testing. Minimal equipment is absolutely necessary to be able to do some testing, some bikes and treadmills and things like that. But some of the more highly technical pieces are certainly nice to have in a way, but they are almost necessary, because it is very important to understand where some of these numbers are coming from. That's why I pushed the last few years of getting a lot of this equipment that we have now within the lab, and we're continuously trying to get more equipment. We have budgeting in the future to get more of this equipment, not because we can say, oh, look what we got. That's fun too. Just to be honest, it's like Christmas when they show up. But the other thing is because this is going to benefit you, the students. Right? We give it back to you, the students. You guys can learn off of this. Labs are where you learn the stuff, the practical stuff, applying what we learn in the lecture and putting it into an actual practical situation, real life. I talk about VO2 in class. Your mind might start to wander off somewhere else. But if we're seeing it in person, and you're seeing somebody on a treadmill or a bike, and they are sweating profusely, and you can hear their breathing, and you can see them straining, and then you look in the screen and you see the VO2 and you can see the numbers, and you're like, that's where it's coming from. That's where these numbers are coming from. Because you hear the breath, you see him breathing or her breathing the air out, and it's going into the machine. It's giving you these numbers, and you can't necessarily see the equipment analyzing and extrapolating how much oxygen or carbon dioxide is in that breath, but you're assuming that's what's happening. And then the numbers are going into the computer screen. You can actually see it in real life. You don't have to necessarily estimate it. And you can test out, okay, what happens if we increase the intensity or maybe decrease the intensity? What happens if we stay at this intensity for the next hour? What's going to happen to this person? You can test that stuff. You can play around with the equipment a little bit. For Wingate is another one. You can do EKGs. You can do maybe some sort of high intensity interval training. We're going to start to be able to do blood glucose as well as blood lactate levels. So you can look at lactate threshold. You can look at glucose levels. You can maybe do some nutritional studies with that. There's a whole lot of different stuff you can do. Again, you don't necessarily have to do a study for it. We can actually just look at it in lab. We can test it and at least show how to use the equipment. That way, when you go out into the field, either in an internship or job or grad school, you have experience in it. And not only do you have experience in using the equipment, but you have experience in being able to translate or at least somewhat make a connection between lecture and the actual practical stuff using the equipment and what's going on in the field and in the laboratory. So that's the importance of it. I get excited about it because I always enjoyed lab. I always enjoyed playing around with some of the equipment as well. When you're in grad school and you kind of have free reign over the lab, you and a buddy sometimes every once in a while would go back and you'd compete on a Wingate. Strange things that we did. We even did it on a max test too at times. But we were kind of bored sometimes, or we just wanted to play around, test some things out. Enough about stories, I guess. I probably tell too much stories. But anyway, thank you for watching. And if you have any questions, comments, leave them down below or contact me somehow. Email me, probably the best way. Take care.